on the education, on the girl's education. And when a girl child is not educated, it affects our ability to even earn later on, and also which goes a long way to affect how she's able to make decisions for herself, the power play between relationships that she engages in, and which makes her at risk of gender-based violence. For the vision that Amazon Leadership Initiative have set, in order for us to have a world where everyone has equal rights and opportunity, it's something that interests me, also something of interest to the work I do and to the organization I lead. And for us to be able to, align and even achieve all the sustainable development goals that we are aiming at, it's very important for us to have, a period-friendly world, not just have it, to also promote it. So be part of the conversation. Now, we know that in many parts of Africa, there are cultural taboos, misconception about menstruation that persist, which leads to stigma, shame, social exclusion. I'm sure this is not it's not new. I don't even need to start from, even when we look within ourselves, in our communities, we can see them. They are glaring. These things are really glaring there in the community. They are not new to us, which has led to, young girls being socially excluded, which impacts their education. Currently, I'm carrying out a research, which is titled Investigating Implementation of Menstrual Policies in English-speaking West African countries. So I'm looking at West African countries. Do we even have menstrual policies which is like policies provides legal framework for government to be able to work. So you can hold them accountable and say, you're not doing this, you're not doing that. But in the first place, we're even looking, do we have, which of the country among these English-speaking West African countries has this framework to start with? And that made me to carry out a case study on Nigeria and Ghana. I know that these challenges exist, but in the course of doing this work again, going back to hear the voice of the stakeholders, which are young girls, it just made me realize that so in this 2024, we still have these big menacing challenges at hand, like young girls who are in school, especially the ones I met in Ghana. They were telling me they were in boarding school, but because there is no proper waste disposal in the school, they had to keep their disposable parts in their locker till they go back home. And because they have fear of people taking it for rituals and stuff, which is also similar in Nigeria for some of the girls are interviewed. And some uses unhygienic materials like rags, like paper, because they can't afford to buy sanitary products. Very costly now. So these challenges are there, numerous, and they are bound. And not just about the challenges, but the impact these challenges has on the girl child. Makes them to miss out of school, makes them at risk of sexually transmitted infections, makes them to even engage in sex for parts so that they can get money. And then they are at risk of teenage pregnancy, at risk of gender-based violence, and all. So in as much as there are lots of challenges, and that is why I'm so happy for what Amazon Leadership Initiative is doing. We cannot just keep talking about the challenges. We have to come together, find solution, which is also part of what I'm doing with my organization, Alora Reusable Pads, where we've been working tirelessly to provide sustainable menstrual hygiene solutions. We are producing eco-friendly and affordable sanitary products for young girls in Nigeria. And we're also trying to look at how pad banks can also offer sustainable solutions, especially in secondary schools. And that's what I'm really pushing as my own part of advocacy work, to push for policies, menstrual health policies, because this will give some form of framework for us to hold government accountable for them to establish pad banks in schools. Also, it is important to also have educational resources to provide menstrual health hygiene information to young girls. Some of the girls I interviewed in the course of my research also made me aware that they never knew anything about menstruation before they started. They just, when it started, they now had to start asking their friends, what, do they know this? Do they know that? No one spoke to them about it. And that is where the issue of lack of comprehensive sexuality education comes in. It is necessary for this to be provided in schools. Also, part of the policy work I'm doing is to advocate for the implementation of comprehensive sexuality education in schools. In as much as NGOs, we go to schools to provide this information as part of our activities in schools, in communities. But we only go there when we have our own project. It's not like we're there continuously. So having it in the curriculum, or having a trainer or having a counselor in the schools will provide a sustainable approach for young girls having access to this information. Another thing that I've done is also to write on a frequently answered question book called My Period, that provides comprehensive menstrual health education. It also helps to debunk myths and equip young girls with knowledge that they need to manage their menstruation, confidently and safely. Now, there is need for us to not just, like I said, talk about the problem, but also to draw inspiration from the stories and experiences of young women and girls. Even your own story, even for the Amazon Leadership Initiative team that have been making changes, striving towards a period-friendly world, we can draw courage and resilience from the things we've been doing in our community and still continuously push for this until we have a period-friendly world, until we have a period-friendly Nigeria, until we have a period-friendly South Africa, until we have a period-friendly Africa. We need to keep pushing. We need to keep having this conversation. We need to keep doing our bits at the community level, as well as pushing nationally at for pushing by using policy, advocacy, and governance tools to ensure the change we want for young women and girls are actualized. So I want to urge everyone here today to become advocates for menstrual health in their community. We can engage our local leaders, starting from ensuring that menstrual health information is no more something that is hush hush. In Africa, we have this culture of silence and shyness when it comes to anything about young people's health, especially their body, especially sexual health. So we have to address this, go into our community, make this something, a conversation everyone finds it easy to have, not something that is done in shyness and with shame. And we can do this by engaging our local leaders, by talking to our religious leaders, by also having peer information session with young girls at the community level. We can also participate in policy dialogue. That is also important. As we're doing community engagements, we need policy dialogue because we need those legal frameworks to be able to hold our government accountable for the things that they need to do, as well as using global declarations, maybe for the Sustainable Development Goal or the Africa We Want, the AU agenda as well. Then we can also go a long way to support initiatives just like we are here. It's part of the support. Being part of this conversation, is part of the support. And also we can do more as our community to provide menstrual health education and resources for young girls. It is also crucial that we call on government, donors, international organizations to allocate equal resources towards menstrual health programs. I know worldwide, May 28th is a day globally that is used in commemorating World Menstrual Hygiene Day. And I've noticed the pattern that when that day is during a government, especially in Nigeria here, first ladies, like either the president or the governor's wives, everyone wants to key into that day to commemorate World Menstrual Hygiene Day. And after that day, everything go back to the way it is. Things just go back to as we were. So it's not supposed to be that way. So we need to hold our government accountable, demand for adequate resources toward menstrual health programs, ensure sufficient funding and support that is vital for successful implementation of these programs. And that is why policies are important. So one question that will ask us to look into for our various countries we need to start looking, do we even have menstrual health policy in my country? If we do, what are the level of implementation? Is it efficient? What are the factors? Because there are like key areas that a menstrual health policy is supposed to cover. UNICEF and WHO have these four indicators that speaks to every menstrual health program. Says first, young girls need to be aware or have information about menstruation before they start. The second one says they're supposed to have access to private places to change. Third one, they're supposed to have access to, menstrual health sanitary supplies. And the fourth one is that they shouldn't even be hindered from doing the things they do before, like participating in education, extracurriculum activities when they are on their periods. And in the course of doing my research, I learned they've updated it to include the fact that even young girls or women who are people with disability need to be able to also observe their period in a dignified manner. So these five factors are the things that speaks to every menstrual health policies. So if your country have, you just look at it, okay, so does it speaks to these five areas? If it doesn't, then we need to carry out advocacy and say, see, this needs to be updated, this needs to be improved upon. So we need to do, there are a lot for us to do at the community level, at the national level as well. Also, beyond menstrual hygiene, it is essential for us to address menstrual disorder like PCOS, polycystic ovarian syndrome, which affect many women and can lead to severe health complications if not managed properly. There is need for us to raise awareness about PCOS or other menstrual disorder, even menstrual dysphoria, that's the painful menstruation. Most times, one thing I've come to realize is people don't even know that these are menstrual disorders. Like we just go through it, go through those painful cramps and just see it as normal thing because there is no information about it for people to be aware that, oh, if you're going through this, then you're having some form of menstrual disorder. There is no awareness, there is no information. And early diagnosis is very important to treatment. And also this leads to making fertility difficult later on for women, and which also have the issues of blaming women in the long run for the inability to get pregnant. So there are so many linking, like so many parts to this when we talk about menstruation, menstrual health. So many parts that just links together. So it is very important that we ensure that people who are affected have access to necessary healthcare and support. So I therefore today use this opportunity to call on every healthcare providers, our government, to integrate menstrual health education and services into their programs. Schools should also include menstrual health in their curricula to ensure that young girls understand their bodies and can seek help if they experience symptoms of menstrual disorder. Creating a period-friendly world requires a collective and collaborative effort, and that's why I'm so happy about what Amazon Leadership Initiative is doing in South Africa and what every other young women leader, impact leader are doing. And everyone who is here on this call today, in this webinar, what you all are doing, for the fact that you're here means you're also interested in having a period-friendly world, and that is a plus on our part. And I really appreciate you for that. So by us working together, I believe we can break the stigma. I believe we can create a supportive environment. We can use our platform, either social media, where we are in our community. When we see a young girl that is in a puberty age, you start talking to her as a big sister, asking her, is she aware? Does she know about what is called menstruation? If she isn't aware, you start giving her more information, even giving her money when she starts to buy sanitary pads, encouraging men in our lives to be able to, be part of the conversation and not shy away from it, because it is necessary for us to engage boys and men as well. And this is how we can be able to achieve this goal of ensuring that every girl and woman can manage their menstruation with dignity. Thank you for being here today and for your commitment to this vital cause. Let us continue to stand together, advocate for change, ensure that no woman or girl is left behind, and together we are stronger. Together we'll make a difference in the world, and we are going to have a period-friendly Africa. Thank you very much.
Thank you so, so much, Miss Sarah. Thank you so, so much. We truly appreciate all of that information, all of that education. We are most definitely walking out equipped. We can never say that we've never heard from now on. And you highlighted that we should also be part of the conversation. So basically, you are saying we must be active members, not just stand there because we think that we are good with just knowing, but we need to be active in terms of being the change, bringing the change as well. But before we bring the change, we need to be the change. So thank you so much. We truly appreciate all of those words, all of that knowledge and education. I'm gonna ask if do we have any questions? I don't know who's assisting me with the chat box. Do we have any questions in the chat box that I can read for Miss Sarah, and then she gets a platform to respond before we move on? Can one of the Amazon leaders please help me out with the questions in the chat box if we have any, so that we can be able to not bypass anything, um, and actually get everything spoken about, or basically go through every question if we have a question for Miss Sarah. Okay, no one is writing anything in the chat box, so I think we do not have any question in the chat box. However, I do have a question. Um, I do have a question, Miss Sarah. You mentioned part of your speech, there's something that you mentioned, and I have a question as to how do we introduce a long-term solution to the menstrual challenge? Because I think for me, well, in my country, South Africa, I do know that one of the things that we're doing is that we all find these, initiatives, or basically these programs where people just go to these disadvantaged kids or schools and they just hand out sanitary towels, and that's it ends there. It's a cycle that every year on this date, that's what we're doing, but then it ends there. And I feel like it's not giving like a meaningful solution of some sort, because giving it out today and next week those kids don't have access to the very same thing that you gave them is not a solution. So now my question is, how do we then introduce a long-term solution to the menstrual challenges that we're facing?
Yeah, thank you very much. So it's something that's also here, similar here in Nigeria. So everyone wants to just take opportunity of that day to just ride on, especially the politicians, to just ride on the whole thing. So the best to have a sustainable approach is policy. We need that policy because that policy will go a long way to really, really help in making like creating a legal framework. And part of it will also include the provision of menstrual sanitary products for vulnerable girls, for young girls as well.
Okay, Miss Sarah, I hear what you're saying. I have
Sorry about that. So it's going to like having a menstrual policy will go a long way to provide menstrual. I'm so sorry about that. It will go a long way to provide, the legal framework, like I said earlier. And also there is sustainable products, not just the disposable. And that also goes a long way to even help the environment. We have like menstrual cups, we have reusable pads. Because when you give those disposable ones, they are just one-time use, and then like you mentioned, the girls are back to the same problem the next month because they don't have the money to even buy in the first place. So there is need to consider, different sanitary product options like what I'm even thinking is we need to get to that stage where girls are able to make options, and because of the level of poverty, it makes them to not even have option, and then they are just left with anything they see to use. So policy really matters. Yes, we're not saying the community engagement should stop. We're not saying people should stop distributing because policy can take time. Governments, before they work on this stuff. So the community engagement is necessary, but while we're doing that, the long-term solution to address this is having a policy. A policy can include having an agency that will be responsible for the monitoring and establishing pad banks across secondary schools in a county or in a region or in the state or in the whole of the country. So these are the things. And then there will be ministries. The policy will also mandate ministries that will be putting money into it. So there's a financial aspect of it, So it won't be just depending on maybe people donating only. There will be like a ministry and agency responsible to put that under their own budget that will be submitted to the government at the executive level, depending on how various countries are run. So these are the way long-term solutions to this can be addressed, and this has been done in countries like Scotland, in United Kingdom, and other countries like that.
Okay, thank you so much, Miss Sarah. There is a question. I see that Selena has her hand up. I'm going to give it to you, Selena, so that you can be able to direct your question or your point to Miss Sarah.
Hello.
Hi, Selena.
Hi, thank you for the presentation. I wanted to ask, based on what you were saying, do you have like a chapter in Ghana so that if someone wanted to join the initiative or champion it in a certain community, they could just join?
For me, I don't have organizations in Ghana like now, but definitely we have like communities, and we have other young people who are doing impactful work, and that was how I was able to, like, when I traveled to Ghana, I was able to get into this hard to reach community through my network. So even as you're in Ghana, you can start in your community. So one thing is maybe to train the trainers. We can probably look at, okay, find another day, maybe Amazon Leadership Initiative can look at organizing people who are interested in becoming menstrual health advocates. And then we can do some brief trainings and provide some resources. And then in your communities, you can just start something, like do something, and then we are always here to provide support. It doesn't necessarily have to be like there has to be an organization. Then I will also now direct you to other organizations in Ghana who are doing things that you can join them and volunteer as well, right? So that's the way it's done. Like for me personally, I don't have an organization in Ghana, but yeah, there are lots of community and networks of like-minded people.
Thank you so much, Miss Sarah. You actually tackled something that I was gonna ask you, because you mentioned in the beginning of your presentation that we should be part of a conversation. Basically, when I translated it, I said you are basically saying that we should be active members of the conversation. And I was gonna ask you, how do you advise us to be part of the conversation? For example, I think we're 30 something, 39 literally joining the Zoom. How do you then advise all of us to be part of the conversation and not just be spectators, but to be active in the whole process of bringing a solution to the problem?
Thank you very much. One way we can be part of the conversation as young people, that it's quite easy for us, that's convenient, is first using our social media platform. Let's start talking about it, writing about it. Let people know that menstrual health and menstruation, even menstrual blood, that's another thing I keep wondering why. When we are creating awareness about these reusable products, people will be like, they'll just be creating this impression that blood is dirty. I'm like, this is coming out from your body, and without you having this blood being shed, if the blood is not being shed every month, it means you can't even get pregnant. If when you're ready to get pregnant or you want to get pregnant, so the blood is not dirty. It's just a natural product being expunged from the body. So first, we need to even start creating that awareness that people shouldn't see their menstrual blood as some form of dirt, something that is ill, because they'll be like, oh, I can't buy reusable pads because I will have to touch it. I'm like, don't you touch your panties? So by writing about it on our social media, creating conversation, conversation prompters, even among ourselves, when we sit with our friends, let's start talking about it. Like, it's not until we start an organization, or it's not until there is a big platform anywhere we are in our own way we can do it. At the community level, we can volunteer with already existing organization. We can pull ourselves together as friends and go into the community and hold peer health education sessions for young girls at the community town hall level or in a school, or volunteer with an organization, talk about it at amongst our circles of friends, engage our brothers, engage our boyfriends, our husbands, as well as also carrying out policy advocacy at the national level. So these are various ways that we can do it.
Thank you so very much, Miss Sarah. Thank you so much. Truly appreciate each and every word that you have shared with us. I think I do not have any other questions from my side. I'm just going to double check in the chat box so that I don't leave a question out, or if there's anyone with their hand raised. But so far, I don't see anyone. So with that, I just want to say thank you so much. Truly appreciate every bit of knowledge that you have shared with us. Thank you so much for educating us and just making sure that we don't just become members in the in the community, but we become active members to bring solutions, to be there for change, to be the change that we want to see as well. Thank you so much. We truly appreciate. There's no other question. There's no one who has raised their hand. So I think I'm free to let you go for now
Thank you
until.
so much for having me, everyone. I really appreciate it. Thank you, Melissa.
Thank you so much. Amazon, are you guys ready? Because we're moving on with the discussion, and I'm so excited because right now we're actually going to get into the panel of discussion, which is something that keeps me so excited because we get to hear different views from different people in different areas of life and different, with different experiences that come with different perspectives. So very much excited. We're moving on to the panel of discussion where we'll be discussing or basically talking about advancing towards a period-friendly world. And we'll be getting people that will share different perspectives from the North, East, South, Central, and West Africa. Introducing the panel of the panelists, basically, that will be part of the panel of discussion. We have 3 ladies, amazing ladies that will actually get to share with us. The first one is Lydia. We have Lydia Ntinyari. She has a BSc in nursing and public health. Her current workstation is the Kenyatta National Hospital in Nairobi, Kenya, as a nursing officer intern. She is very passionate about advocating for and providing health education and health promotion services to all people of reproductive age, but with the key focus on the adolescent and the youth, especially on topics such as menstrual education and menstrual hygiene. She is also a trained youth mentor and a youth leader. Can you please make sure that you comment in the chat box with fire emojis as I am introducing our panelists? So we've got Lydia, ladies and gentlemen, as I've just read her bio. I'm going to introduce all 3 of them and then pose the question and give each one the chance to indulge in the question. So the second panelist is Linesi Piri. She is a development expert and activist from Malawi with a strong focus on gender and sexual reproductive health rights. She has held key roles at Action Aid Malawi and Purple Innovation for Women and Girls, where she worked on gender-related projects. Currently, Linesi serves as a gender and sexual reproductive health rights expert at She Unites Africa. Her commitment to empowering women and girls extends to her leadership of Girls Arise Club, advocating for improved girls' access to education in rural communities, northern Malawi. She is, ladies and gentlemen, Linesi. Make sure that you give her all the fire emojis as we welcome our panelists. The last panelist is Yusera. She is Yusera. She's currently a 300 level student in the Development of Educational Health Science at Kwara State University, Malate. Environmental health is a fascinating field that intersects science, public health, and community well-being. She is a chef. She finds joy in creating delicious dishes. Her heart beats for design. She's an aspiring graphic designer, eager to explore the world of visual communication. Writing is her sensual part. As a personal development writer, she believes in the transformative power of words. Ladies and gentlemen, these are our three ladies in the panel and ready to discuss several things with us. I just hope that they're all here. They've all joined the Zoom. Can we please just welcome them in the comment box below, in the chat box below? Can you please welcome them? I am actually gonna pose a question to them, and I'm gonna give each one of them an opportunity to answer the question, and we're gonna go in the order where I have called them. So the first person is gonna be Lydia, and then Linesi, and then we're gonna have our third panelist, which is Yusera. So ladies, I would really like to ask from you, what does it mean to you when people say, or when you're asked to define menstrual equity? What is menstrual equity? And what can you give us in terms of your insight from your own community, from your own observations upon the topic menstrual equity? Over to you, ladies.
Hello, good evening, everyone. Welcome to this session. Welcome to our discussion. And as I have been introduced, my name is Lydia Tinyari, and I am going to address the question that has been asked. According to me, menstrual equity basically means that women and girls have equal access to menstrual products and also have equal access to menstrual health education, and there are menstrual health policies put in place to ensure that these menstrual products and menstrual health education reach all women and all girls in their regions where they reside. And looking at how this menstrual equity has been achieved, you will realize that despite the fact that many NGOs and the community-based organizations and individual activists and advocates have come out to try and advocate for menstrual equity in many regions, especially in East and Central Africa, you realize that there still lies a big challenge, as our guest speaker has already said. In East and Central Africa, there is a large gap to addressing menstrual health awareness, raising menstrual health awareness to girls and women. You'll realize that most girls reach their first menstruation, without ever having had the word menstruation or even knowing what it is. Or some, actually, they might have heard of menstruation, but in real sense, they do not understand deeply what it means or how it looks like, or how, in case she experiences menstruation, how she can carry herself, or how to handle it, or what to use in case she finds herself with menstruation. So there is a big gap, as we've already discussed, and in Central and East Africa, many people need to do something about the large gap that is there. When you look at the situation in Kenya, there is a big gap when it comes to the urban setup and the rural setup. There is at least a higher level of awareness in the urban centers in Kenya, in my country, Kenya. At least a large number of people understand what menstruation is, and they have an idea of menstrual product that they can use, though most of them, they only know of menstrual pads or sanitary towels that are disposable, the common ones. Those are the ones that many people are aware of. And in case you mention about other menstrual products like the menstrual cups, the reusable menstrual sanitary towels, and many others like the tampons, many people actually lack idea of those other varieties. Yet, if they were aware of some of the products like the reusable sanitary towels, most of them will be benefiting from using those reusable sanitary towels to save on the cost, and also as a sustainable way to manage their menstrual periods. So in the rural setup, many people have an issue with accessing the sanitary products. They do not afford, most of them do not afford the hygienic menstrual products. So most of them result to using things like rags, things like soil. Some end up using things like even soil or cow dung or such things, which even might predispose them to diseases, urinary tract infections, and so many other infections that can cause harm to their health. So there is a large gap. There's a big gap that really needs to be filled, that really needs radical action to be taken by all of us, not only by the few individuals who have been doing who have been trying to implement their projects by providing sanitary towels once in a while. Then for the rest of the time, people are left to suffer, the girls. And also when it comes to awareness, you'll realize that menstruation is not a topic that people can talk about openly in both the rural setup and the urban setup. Especially men and boys refrain from talking about such topics, and it would be essential for all of us, both men and women, to be able to speak about menstruation openly in order to reduce the stigma, the shaming, and all. So to achieve the menstrual equity, all people need to take action, and also we need to enforce menstrual policies that are there and ensure that menstrual equity is something that is achieved to all, both in rural setup and also in urban areas in our regions. And another thing that needs to be done is to address the myths and misconceptions that are there, the misinformation and the taboos that are there, that in some areas, people who are experiencing menstruation are even isolated. You realize that people are made fun of in case they have menstrual accidents. So such things, they need to be addressed, and that will help reduce the stigma around menstruation and avoid the issues of shaming. And also in some areas in East and Central Africa, you'll realize that there are less or limited facilities to dispose of the used menstrual products. So some people have challenges actually even of maintaining their personal hygiene due to such shortages or unavailability of places, private clean places where they can change their used menstrual products. And that also is a challenge, and it needs to be addressed in order to promote the girls and experience menstrual products with dignity. And also it will help in school attendance for the girls who may be fearing to go to school when they're experiencing menses. It will help them be comfortable to attend their classes and also participate in community activities. So there are various NGOs in the region, East and Central Africa, NGOs like ZANA, both NGOs and CBOs that are really doing a great job. And also at an individual level, there are people who have championed various projects to ensure that menstrual equity is achieved. Yet we are still far if considering how things are. So much need to be done. We need to do a lot of we need to put a lot of effort to achieve menstrual equity in the whole region and also in Africa as a whole. So that's basically what I had to say, and I'll hand over to the next panelist to continue. Thank you very much.
Thank you so much, Lydia. Thank you so much. I'm not seeing any questions as yet, so I think we're gonna continue with the program, and we're gonna have Linesi to proceed as well. The question was, how do you define menstrual equity? What does it mean to you? And from your experience, what does it mean when people say menstrual equity? Can you please just enlighten us?
Thank you, Melissa. Good evening, everyone. I'm Lines Pili from Malawi. To me, when I hear the word menstrual equity, it's all about making sure that the menstruating group of people should have their menstruation safely, comfortably, and without any form of exposure to stigma or shame. But then when we talk about this, and in order for them to have this, they don't just need access to menstrual products. These women and girls need access to menstrual health education in order for them to manage their periods. And also, they need access to disposable facilities, because if they do not have these disposable facilities, it will be hard for them to change the absorbent materials. And also, they also need supportive policies that are not just on paper, but then that are effective and that they're being implemented. So basically, it's just about making sure that these groups of people, they have menstruation freely and comfortably. In Southern Africa, there are a number of initiatives from individuals, organizations, and international agencies that are advocating and supporting menstrual health equity. But despite the existence of these initiatives, achieving menstrual health equity in Southern Africa is still a struggle due to a number of issues. Some of these issues include economic issues. In most of these countries, women and girls come from rural areas, and with this, it is hard for them to afford menstrual products. So in most cases, these women and girls resort to unhygienic means in order for them to manage the period. Some of them go to the extent of using torn blankets, and some use torn clothes, or in worst scenarios, they use newspapers. So this is a very big challenge in Southern Africa. And the other issue that is affecting menstrual health equity in Southern Africa is cash flow perspectives. Most of the communities in Southern Africa, they have not yet normalized menstruation. Menstruation is still regarded as a topic that cannot be discussed openly. So by the time most of the girls start menstruating, they do not have information about what is expected of them, how they're supposed to look after themselves, the kind of products that they're supposed to use, and also how long they're supposed to be wearing the products that they use. So by the time they start menstruating, they basically have no knowledge, and they end up doing the things that are not safe for them health-wise. In addition, there is inadequate policies in Southern Africa that are advocating for menstrual health or supporting menstrual health in Malawi, Mauritius, and all other countries in Southern Africa. However, there are still some countries that have the policies, but then they're not as effective as they should be. Mauritius and South Africa, they have a tax-free policy on sanitary pads, But then despite the existence of this policy, accessing sanitary pads in these countries is still so expensive, and most of the girls cannot afford these products. With this, many girls in South Africa do not go to school when they're menstruating, so it is really hard for them. In addition, we also have inadequate disposable facilities, both in public and private spaces. With this, the girls and the women are finding it hard for them to change the absorbent materials, which is risking them to infections. And also, despite the fact that almost all women and girls affected with menstrual health issues, the disabled and the LGBTQI community are the most affected. For disabled people, it is very hard for them to access menstrual health products and also the facilities that are in schools or in other public places because they are not user-friendly for them. So for them to access them, it is hard. And also in situations where they need to get menstrual products, it means they'll have to have someone to support them. And in circumstances where someone is not there to support them, it becomes hard for them to access these facilities because they're not user-friendly. And for the LGBTQI community, they're exposed to discrimination. So with this, for them to access menstrual health education and menstrual health products, it is really hard. But then, however, that we have the ongoing struggles, I believe it is still important for us to advocate for menstrual health equity and for us to achieve menstrual health equity, because menstrual health is a human rights issue and also it is a gender issue. So if we achieve this, it will be easier for girls to access, for them to go to school, because if they have access to menstrual health products, they'll be confident enough that they will not be exposed to any form of embarrassment because they're using the materials that can be trusted. And also it will help to enhance productivity among women. If these women have access to menstrual health products, they'll be able to go on with their normal life. They'll be able to go to work, they'll be able to do businesses, hence they'll be able to be empowered economically. And if these women are empowered economically, they'll also be able to support the girls. So by empowering the women, we'll not just be empowering them, we'll also be empowering and protecting girls from risks that are associated with using unhygienic products. And also it is also important because it will help us to remove the existing cultural issues that are affecting women and girls. For instance, in Malawi, if women and girls are menstruating, in most rural communities, they're not allowed to go into gardens, they're not allowed to touch fruit trees because the thinking is if they do so, the trees will not be able to bear fruits. And they are not only exposed to this, and for those who are having their first menstruation, they're locked in houses and they're supposed to stay there for a period of 1 week, which means the girls are not allowed to go to school and they're not allowed to speak to anyone during this period. They're not allowed to prepare food, they're not allowed to add salt to food. So all these affect girls and women mentally. So it is important for us to strongly advocate for menstrual health equity, as we'll be putting girls in a safer place. Thank you.
Thank you so much, Linesi. I truly appreciate all the information that you have shared. We truly appreciate it. Thank you so much. I'm not seeing any questions directed to you as yet. I'm not seeing anyone who has raised their hand so far. So I'm gonna move on and let the third panelist get to also indulge in this question and give us more information based on this particular question. And we do have Yusra in the panel as well. And I would really like to ask you, ma'am, to also please just give us your insight as to what it means to you when people are saying menstrual equity. How do you define it? What does it mean in your own experience, in your own observations and perspectives? What is menstrual equity. Over to you, ma'am.
Good evening, everyone. I'm Menstrual from West Africa. If we say what's menstrual equity is when we ensure that everyone who is menstruating, that's the female, the ladies and the women who have fair and equal access to resources and support their needs during their periods. It's also about treating menstruation as a normal part of life and making sure nobody faces unnecessary challenge or discrimination because of it. Because people manage their period with dignity and independence, and nobody should feel ashamed or stigmatized because of a natural body process. Because it's a natural body process that comes free from our body, and we have to find a way to protect our dignity from it. Then we should also be able to talk openly about our periods and provide accurate information. People can make informed choice about their health, because we don't have to keep it to ourselves that I'm doing my menstruation, I'm doing my this, I'm doing my that. It should be something you should be free about, and something. And I also feel these resources we use, that the pads and the likes, are a bit expensive. So if people at the urban area are able to afford the pad, tamponins, and the likes, for people at the rural areas are unable to afford it, in which it's very expensive. And we also need to have policy that can support our menstrual health. Policy that can support our menstrual health, that can provide free menstrual products in school, workplace, and public space. Then we should also be able to break our stigma like stereotype challenge, and encourage open conversation about our menstruation, and break the silence around periods, which helps to reduce our shame and misinformation. And also, we should also have access to safe and affordable menstrual products in essential for overall health. And also recognize the people of all gender can menstruate. It's about fairness and understanding individual experience, because everyone has his own experience, because each body reacts to this menstruation differently. Some undergo pains, some don't undergo pains, some do go to the clinic, some do go to the hospital to collect drip. So why some do theirs in a way that you won't even know that they are also doing theirs. Then also prioritize our cultural change. We also need to prioritize our menstrual equity, which create a world where periods are normalized, respected, and supported. Because some people will be like, what's the end of this? Why some people don't like the idea of this menstruation, and they wasn't even hear you saying that you're on your menstruation, you're doing your menstruation, which is not expected to be. Then we talk about the poverty, lack of access to affordable menstrual products, sanitation facility, and education about managing their menstrual health. Then education impacts. Yes, we should also have education impacts about educating the girls in school days, because how they can manage their periods properly. Then we should also make them know about their health consequences about this, because poverty period has immediate health consequences, because some girls will engage in transactional sex to pay their menstrual products, and which is not expected to pay. And them engaging in transactional sex increases the vulnerability of HIV infection in them. They make advocacy efforts to remove taxation on menstrual products and improve data on menstrual health are crucial steps. Thank you.
Thank you so much, ma'am. We truly appreciate the knowledge that you have shared with us. I am going to take a few questions. If we have questions, can everyone please just drop their questions should you have a question, so that I take some questions and allow our panelists to actually respond to a question that you may have. So please just comment in the chat box below if you have any question, so that we can be able to direct the question to the panelists. If there's no question, I do have another question that I will ask to allow our panelists to engage on it, to give us more knowledge and more information and education as well. So we do not have any question from the audience. Okay, so we do not have any question. I'm gonna move on to the second question that I have for our panel. The question I have is how can we overcome barriers to menstrual equity? So now that we have defined what menstrual equity means, now that you have shared your knowledge with us as to what menstrual equity means to you, coming from different perspectives with different experiences, now I want to know, with all the experience, or basically every bit of knowledge that you have, what can you say, or how can you tackle this question and educate us as to how can we overcome barriers to menstrual equity? I'm going to give it back to Lydia, and then after Lydia, we're going to have Linesi, and then it goes on like that.
Okay. The barriers that we've mentioned, one of the ways to address them is when it comes to stigmatization and taboos that prevent people from achieving the menstrual equity, we can organize information sessions and sensitization programs where people are taught or educated on matters to do with menstruation, or given menstrual education, and made to you make them understand that menstruation is just a normal body process. It's just a biological process taking place, and there is nothing negative or nothing unclean about menstruation. And by addressing such cultural issues like the stigmatization and the taboos and myths and misconception around menstrual periods, that will help prevent the stigmatization, and will address the barrier of people failing to achieve menstrual equity due to the stigmatization and taboos that are there in the community. And on the barrier of people not being able to access the menstrual product due to issues with affordability, the people they can be provided with the menstrual products in public schools or public setups, in public institutions, or these menstrual products are made available at affordable prices, subsidized prices, and they are made tax-free. Here, people can be able to access them with ease, and also people should be taught, women and girls should be taught on other alternative menstrual products, and not only the disposable sanitary towels that are commonly used. The disposable sanitary towels are usually a bit expensive, and given its nature of being used and disposed, it will not last for long, or it will not last a person for a long time. So when people are taught on other alternative methods to use, they are able to choose other methods that are affordable to them, or that are sustainable to them, and that will address the issue of not having access to menstrual products or not being able to afford the menstrual products. Also, there should be policies and legal frameworks that will enforce the menstrual equity, or that will guide people to achieve menstrual equity. The policies around taxation of menstrual products, the policies around providing menstrual education to all people, the policies around introducing or integrating menstrual education in school curriculum, all that will help address the barrier of menstrual equity, some of the barriers to achieving menstrual equity. And when these policies are applied and enforced, at least we'll have easy way, or we will have an easy time to learn these menstrual health issues and also have access to the menstrual products, and that will help in achieving the menstrual equity. And on matters to do with the cultural issues, we've already mentioned that some cultures isolate people because they're menstruating. Some cultures prevent people from participating in various activities because they're menstruating. Some cultures even hinder people from maybe attending churches and all. So by trying to demystify some of the myths around menstruation, it will help to achieve menstrual equity, and that will address all the barriers, most of the barriers that are preventing people from achieving menstrual equity. Thank you very much. Back to you, Melissa.
Thank you so much, Lydia. Absolutely appreciate that you have indeed answered the question. I'm going to ask Linesi to please also jump in. According to your perspective or your own knowledge, how do you think we can be able to overcome the barriers of menstrual equity?
Thank you, Melissa. One of the solutions to the challenges, I think it would be by empowering religious and traditional leaders, since these people have a great influence on the community members and on the church members. Once these people normalize menstruation, it will be easier for them to change the existing cultural beliefs or norms that portray menstruation as a negative thing. And the same thing will also be applied to church leaders. If these people can be able to normalize menstruation, they'll be able to influence the church members to have a positive attitude towards menstruation. The other thing would be by ensuring that there is access to menstrual health education in public schools as well as in communities. Girls need to know what menstruation is. They need to know how to manage menstruation. Most of these girls, they are suffering just because they do not know how to manage their menstruation. They do not know other options that are there to be used when they're menstruating. So if they have access to education, they'll have multiple choices when they're menstruating, and they'll be able to manage their menstruation safely. And also when we are educating these communities, males, boys should also be involved in this, because in most cases they're the ones that shame women when they're menstruating. So if men and boys will be able to understand that menstruation is just a normal thing like any other thing, it will be easier for women and girls to be safe from shame that is associated with menstruation. In addition, I also believe that supporting the existing surveys that are related to menstruation would be of great importance, because this will help us to make informed decision on programs or solutions that should be implemented in order to solve the existing challenges. Because if we're able to have the existing data, it will be easier for us to know how best to come in when implementing menstrual-related programs. Lastly, I would also like to say, I believe if we can have policies policies that are effective, not policies that are just on paper. It will be of great importance for us to achieve menstrual health equity. For instance, if we have policies that promotes local companies that are producing menstrual health products, most of the menstrual health products will be less expensive and many people will be able to access them. And also, if these companies or government can be able to provide free menstrual products to those that are coming from low-income families, it will be easier for us to achieve menstrual health equity. And having said all this, I would like to encourage everyone who is attending today's session that we should be active and we should strongly advocate against negative menstrual health perceptions. Our efforts, combined with other stakeholders' efforts, can help us to change the current struggles, and it will help us to change the menstrual, or to turn the menstrual equity dream into reality for women and girls in our communities and in Africa as a whole. Thank you.
Thank you so much, Ms. Linesi. We truly appreciate all of that. That gave us so much knowledge and a clear understanding as to what the barriers are that we're facing and how to overcome them. Without wasting time, I'm going to ask Ms. Yusra to please come on board as well, to just give us your own, perspective of how you think we can be able to overcome the barriers of menstrual equity. And what are the barriers in your own view? What are we facing that gets to be a challenge or a barrier when it comes to menstrual equity, and how can we overcome that? Over to you, ma'am.
I think stigma is one of the first things we should have, because there is this stigma that placed on us, on people who have this menstruation and life. And I say lack of access to resources again. Some people have the access to the resources, that's like the, the, the pads, the tampons, and the like, while some don't have the access to the resources in which it affects them, in which they use a clothes or a tissue or a cotton, in which it has what effect health condition is going to cause into the body. Then we also have these cultural taboos where they say this our leaders, some who have this belief that menstruation persists in various societies, in which they exclude them from some activities, isolation, and put them in isolation and discriminate them, all in the name of they are doing demonstration. Then there is this lack of education and awareness. Some people don't have the knowledge of what menstrual health is and what it leads to. The misconception, the fears, and inadequate management practice is one of the things we have. Lack of education has place this stigma on them and allow them to not be informed in the decision they will make on their menstrual health. And I think financial constraints, yes, when they are unable to have access to the resources, then inadequate sanitation facilities. Sanitation facilities, where you have lack of private and hygienic toilets we have lack of private and hygienic toilets that affect girls' ability to manage their period conflict. When we don't have good toilets, whereby I'm on my way and I want to change my pads, I'm full, I can't just walk into the toilet and say I want to change. It's one of the things that, and females do skip school because of this challenge they have, because they have no right, they have a sanitation facility, but it's not actually enough or clean enough for them to actually use that that sanitation facility. Then we should have a policy gap and implementation challenge. That's where the inadequate policy of their poor implementation hinders progress in menstrual equity. Without effective policy, initiative, and funding, addressing period poverty becomes difficult. Then gender norms and discrimination. We have gender norms and discrimination. There's gender stereotype, unequal treatment during menstruation. Then we have discrimination. Discrimination affects girls' self-esteem, participation, and opportunities. Yes, it affects their self-esteem in a way. If I want to present and I'm menstruating and I'm having cramps, I have this stigma in me that my self-esteem will be pulled down, and then lack of research and data. Limited data on menstrual health prevents evidence-based intervention, yes, in which there are limited access to data, limited data to menstrual health. Then without accurate information, targeted solutions are elusive. Then how do we now overcome these barriers? Because without we overcoming it, there's no how we can move forward. We have to have education and awareness, then comprehensive education, educating both girls and boys about menstruation. In this aspect, we don't have to only educate females alone. We have to educate both females and the males about the menstruation so that it will reduce the stigma and promote understanding between each of them. Then introduce this menstrual health education into schools, public schools, private schools, or any school, the higher institutions, the primary schools, and the likes, so that they can teach the girls and the boys how to manage how females should manage their period and how the females should manage their period, and provide them with accurate information in which it will help them. And access to menstrual products, they should make menstrual products affordable or even free. Then government can remove subsidies, or community initiative can help also too. Then we should have a distribution channel where they can establish distribution channel to ensure products reach rural and unserved areas. Then we should have sanitation facilities. Safe toilets improve access to clean and private toilets. Girls need a safe space to manage their periods without embarrassment. Then we should have hygiene facilities. Ensure schools and public places have proper hygiene facilities for changing and washing. Then we should have policy change. That's tax exemption. We should tell our government to reduce the tax they are putting on the menstrual resources. Advocate for tax exemption on menstrual products. This reduces the cost and make it more accessible for females. Then community engagement. Maybe we can have community workshops, organize workshops to raise awareness about menstrual health, involve communities, leaders, parents, and local organizations. Then we should now engage the men and boys about menstrual equity. So everyone responsibility. Engage men and boys in conversation to break down the stereotype. Then we should have research and data. Collect data, understand the specific challenge faced by different community. This data helps to provide solution effectively. Then research innovation, explore sustainable and eco-friendly options like reusable pads or menstrual cups. Empowerment and advocacy. Empower girls. You teach girls about their rights and empower them to demand better menstrual health service. Advocacy groups support and collaborate with organizations working on menstrual equity, amplify their voice. Remember, overcoming barriers to menstrual equity requires a collective effort. By addressing this challenge, we can create a world where menstruation is no longer a barrier to education, health, and dignity. Thank you.
Thank you so much, ma'am. I truly appreciate that. We need to be cautious of the time. So with that, I'm gonna move straight and I'm gonna move fast because yeah, time is literally against us. Having to think that we actually started late also. I don't see any questions. I don't see anyone raising their hand, so I'm not even gonna give a minute to have that. We're gonna move straight. Exilda said that there's a video that's going to play. I don't know if we still have that going on, because straight after the I'm going to be introducing Exilda to actually take part or to speak about the campaign launch. So can please make me aware if the video is still going to play, or should I go straight to introducing the next person, which is Exilda? I don't know who can make me aware. One of the leaders in the Amazon, please. Okay, so I'm being told to go straight to introducing Exilda. So moving on with our program, this is the last part before we actually close off. We are going to be introducing Exilda to come speak on the campaign launch. She's a member, basically she's part of the Amazon Leadership Forum. Exilda is Exilda is a Zambian, an economist and program active associate at the Amazon Leadership Initiative with the profound commitment to fostering positive change. Exilda channels her energy and expertise towards empowering young girls and helping them realize their full potential. As an advocate for financial literacy, she's passionately equipping young women and girls with the essential knowledge and skills they need to navigate the complex world of finance confidently. Exilda's work extends beyond borders as she leverages digital tools to connect with and inspire young females, sparking transformation in society. Her heart is deeply touched by the cause of children living with disabilities, where she strives to ensure their voices are heard and their needs are met. Exilda is equally concerned about the pressing issues of climate change and socioeconomic disparities. She actively engages in initiatives that address these global challenges, driven by a vision of a more sustainable and equitable world. Exilda is a beacon of hope, using her talents and passion to drive meaningful change and create a brighter future for all. Ladies and gentlemen, I'm going to hand over to Exilda as she will be speaking or basically making the campaign launch for us. Exilda, over to you, ma'am.
Good evening, everyone. I just want to thank everyone who made time to join our webinar. And most important, I'd like to thank our guest speaker for creating time and actually speaking and creating more awareness and actually opening doors for us to collaborate so that we ensure that we address issues of menstrual health and hygiene. Menstrual health and hygiene management continues to be a very critical issue amongst us women because it's something that we experience on a monthly basis, and it's something that we relate to each time someone speaks. Most of us are fortunate to have the opportunity to be able to handle our menstrual, to address our menses in a very hygienic manner. But majority of the people out there are unable to do so. Others lack adequate water, others lack adequate facilities, others lack the opportunity to just learn and have the knowledge and be impacted to ensure that they're able to manage their menstrual health in a dignified manner. So as the Amazon Leadership Initiative, we are dedicated in ensuring that we address issues of menstrual equity. So we want to see a world where the girls are able to access sustainable materials, are able to attend to their menses in a very hygienic manner. So from this webinar, we are going to launch a campaign called DIY for Dignity, make a part to make a difference. So just as our previous guest speaker spoke, it doesn't necessarily have to take an organization to ensure that we address issues of menstrual equity. Even as an individual, you're able to address some of these issues. And that's the reason we came up with a campaign called DIY for Dignity. So DIY simply is do it yourself. So through some of the resources that we'll be able to share on how to create reusable sanitary towels, we're calling upon all young female leaders to actually join us and be part of our campaign and ensure that you're able to help 1 or 2 girls from your communities. So our campaign encourages our young female leaders to actually use home materials. So it could be an old t-shirt, it could be an old wrapper, it could be an old towel or an old fleece that you could use. It could be an old towel, an old fleece that you could actually use and ensure that you create a pad and actually donate it to maybe the next girl who stays right next door that might be struggling with ensuring that they have enough sanitary towels, because we believe having to provide the disposable ones isn't sustainable. Because how long are you going to ensure that you donate to that person? So by creating at least a reusable pad, you're sure that someone will have it for at least 2 years. For the next 2 years, they'll be able to handle their menses in a very dignified manner. So the campaign also calls upon the collaboration of our young female leaders to actually work together and ensure that they're able to teach other young girls within their communities on how to properly manage their menstruation. So it goes beyond having to just donate the reusable pads. It also goes as far as educating one another. We're actually calling upon each and every young female leader to uplift at least one girl by the end of this year. At least by the end of this year, you should be able to point at least to one girl that you helped, one girl that you educated, and one girl that you actually empowered. So the theme for this year is together #period-friendly world. So it's just basically calling upon all of us to work together, to join hands and ensure that we create a period-friendly world. So from our campaign, it also encourages us to actually work together. So if you're coming from the same country, you can actually come together and just put materials together and ensure that you create pads and either donate them to a school. You could be coming either from Zimbabwe. If one person has an old fleece in their home, another person has an old wrapper in their home, you could actually share the materials, sit down together and actually create the materials. So if you need any help towards the campaign, feel free to reach out to any of the caucus leaders. You can reach out to the associates so that we find a way on which we can work together towards this campaign. And also to encourage you, we'll share a few hashtags where you could be able to post once you create a reusable pad and actually encourage other people to also do the same. So in conclusion, would just like to encourage each one and every one of you to actually make a difference within your communities. Let's ensure that we educate one another to break some of those taboos, to ensure that the young girls, especially the ones that are actually entering into their puberty stage, are well educated and aware of some of these issues that they may come across. Because in most of our communities, issues to do with menstrual health are a taboo and are not openly spoke about. So we find that people will tend to shun away from such conversations.
But as people shun away from these conversations, it means that we're actually not helping each other. Because just as our previous guest speaker spoke about PCOS, other people might be thinking it's just a normal thing and might be quiet without even actually realizing that it's a serious health issue that has to be attended to. So just like to encourage each one and every one of you to participate in this challenge. And we look forward to collaborating with each one and every one of you. Thank you.
Thank you so much, Exilda. This is basically the end of the webinar. Thank you so much for joining, everybody. As you are logging off, please just comment in the chat box. Say, I am empowered to empower. I am empowered to empower. As you log off, that is the end of this webinar. And that is all from me tonight. See you next time. Signing out as Melissa Nzube. Thank you so much for joining. I am empowered to empower.
Tryphosa, and Lina. You people are not leaving the meeting.